Have you ever kind of wondered if your top teeth hang over your bottom teeth just a little too much? Or, maybe it's the other way around for you? Well, today we are diving into two of the most common dental situations out there, the overbite and the underbite. We're going to break down what they are, what causes them, and probably most importantly, what you can actually do about them.
So before we get into all the technical stuff, let's just start with a quick personal check-in. Just for a second, think about your own smile. Does everything feel like it lines up pretty well? Or have you ever thought, maybe my top teeth stick out a bit, or maybe my bottom jaw is a little too far forward? That little question right there is the perfect starting point for everything we're about to talk about.
Okay, so the official fancy term for what we're talking about is malocclusion. Now, I know it sounds a little intimidating, but it really just means a bad bite. Simple as that. And you'd probably be shocked to learn just how incredibly common this is. This one word, malocclusion, is really the key to understanding both overbites and underbites.
All right, first up, let's tackle the overbite. You've definitely heard the term thrown around, but let's get into the nitty-gritty. What is actually happening with your teeth and jaw when you've got one?
So what is an overbite, really? Well, it's when your upper front teeth overlap your lower front teeth. But here's the kicker. The most important word is excessively. A little bit of an overlap, say around 10 to 20%, is actually perfect. That's what we want. The problem starts when that overlap gets to be too much, and that's what orthodontists call a deep bite.
So where do overbites even come from? It's actually a pretty fascinating mix of nature and, nurture. Genetics plays a huge part. Yep, you can thank your parents for your jaw shape. But habits, especially from when you were a kid, we're talking about things like thumb sucking for too long, constant pacifier use, or even chewing on pencils. All those things can literally push your teeth and jaw into the wrong position over time. And this is why getting it checked out is so important. A major overbite isn't just about how your smile looks. Not at all. It can lead to some very real day-to-day problems, like chronic jaw pain, wearing down your teeth way faster than you should, and even making it hard to do something as basic as chewing your food.
Okay, now let's completely flip the script. We've talked about what happens when the top jaw sticks out, but what about when it's the lower jaw that's leading the charge? Well, that, my friends, brings us to the underbite.
An underbite is pretty much what it sounds like. It is the literal opposite of an overbite. In this situation, your lower jaw and your lower front teeth stick out, sitting in front of the upper teeth. You'll often notice this one a bit more visually than an overbite because of how it can affect the look of your chin and profile.
Just like with overbites, genetics is a huge factor here. The size and shape of your jaw are, a lot of the time, just passed down through the family. But of course, other things can contribute too. Childhood habits like pushing your tongue against your teeth, or even just weird issues with how your baby teeth fell out and your adult teeth came in.
And the risks here are just as serious, An underbite can make it tough to chew properly, or even to speak clearly. That unnatural bite can cause your tooth enamel to wear down way too fast, and it can create a noticeable imbalance in your facial structure. So the main thing to remember is that both of these conditions can have some serious long-term consequences if you just leave them be.
All right, so we've looked at them one by one. Now let's put them side by side, head to head, so we can really see the key differences crystal clear.
See? This table really lays it all out, doesn't it? Look at the jaw alignment. It's a perfect mirror image of each other. And while some of the causes overlap, like genetics, the main risks are pretty different. For an overbite, you're really looking at jaw pain and tooth wear. For an underbite, it's more about trouble with chewing and that facial imbalance. Now, what about those weird terms at the bottom, Class 2 and Class 3? Let's quickly clear that up.
This is just the lingo your orthodontist would use. So, an overbite is what they call a Class 2 malocclusion, where the upper jaw is out in front. An underbite is a Class 3 malocclusion, where the lower jaw protrudes. It's really just the official way they classify these two very different jaw alignments. Nothing to be intimidated by.
So, we have clearly laid out the problems. But what about the good part? The solutions? Well, the great news is that modern orthodontics has some absolutely fantastic ways to correct both of these issues. Let's walk through what that whole treatment journey actually looks like.
So treatment usually follows a three-step path. It all kicks off with a really thorough consultation and diagnosis. You got to figure out exactly what's going on first. Then comes the active treatment part. This is where braces or aligners or other gadgets do the heavy lifting of moving your teeth and jaw. And finally, you have the retention phase. And trust me, this part is so crucial. That's when you wear a retainer to make sure your brand new perfect smile actually stays put.
So, what does that active treatment phase actually involve? Well, you've got options. Traditional braces are still an incredibly powerful and effective tool. Clear aligners have become a huge favorite for anyone who wants a more low-key look. For kids who are still growing, there are special appliances that can actually guide how their jaw develops to prevent bigger problems down the road. And for the more severe cases that are rooted in the skeleton, jaw surgery can create a truly life-changing, perfectly aligned result.
Now, I know it can be tempting to just think, it's just how my teeth are. What's the big deal? But let's take a second to really drive home why ignoring a bite problem is a risk you probably don't want to take.
First off, let's just talk about your daily comfort. A bite that's out of whack puts this constant weird strain on your jaw joint, also known as the TMJ. And that strain doesn't just stay in your jaw. Oh no, it can actually radiate out, leading to chronic jaw pain and even those nagging, hard-to-pinpoint headaches.
Next up is permanent damage. When your teeth don't meet up the way they're supposed to, they grind against each other in all the wrong ways. Over months and then years, this can literally wear away your precious tooth enamel. And here's the thing about enamel. Once it's gone, it is gone for good. And finally, there's something you might not even connect to your teeth: the way you talk. The exact position of your teeth and your tongue is super important for making certain sounds. A major overbite or underbite can lead to a lisp or other speech issues, and that can, in turn, really affect your confidence, whether you're at work or just hanging out with friends.
So, it's pretty clear that having a balanced bite is about way more than just having straight teeth. It's absolutely fundamental to your long-term health, comfort, and how your jaw functions. We've seen what causes these issues and the risks they carry. But the most important thing to take away from all this is that there are amazing, effective solutions out there. Your smile is such a big part of your personal story. The only question left is, what are you going to write in its next chapter?